to cover today, so we are going to dive right in. Thanks so much for joining us today. This is our FY 2025 CoC Program Competition Overview for the Texas Balance of State. My name is Hope Rogers. I am the Senior Director of CoC Programs for the Texas Balance of State Continuum of Care. I'm joined today by some of my colleagues at THN, as well as a guest presenter. From here, I'm going to pass it over to THN staff to introduce themselves. Billy, would you mind giving a quick intro?
Sure. I'm Billy Strew, Director of Planning at Texas Homeless Network. I'm glad that you're all here this morning.
Thanks, Billy. And Dusty?
I'm Dusty Whirl. I'm the CoC Performance Manager at THN.
Awesome. Thanks so much. And then Craig, if you would mind giving a brief introduction, please.
Hi, everybody. I'm the CoC, Operations Coordinator. Sorry, it's Monday.
Title change. Thanks so much, y'all. I am pleased to welcome a guest presenter with Framework Strategies, and I'm going to pass it to Jessica to introduce herself, and then she will take it from there.
Jessica Sones. I'm with Framework Strategies. We are a small housing and community development consulting firm. We work with communities around the country around homelessness strategy, specifically with the expertise in the Continuum of Care program. Our firm has been working in one form or another with HUD's Continuum of Care program since its inception in the 90s. So we are happy to be partnering with the Texas Balance of State to support this year's NOFO competition. And we'll get into what that means and all the things you need to know. So everyone's on mute now, but we will have time at the end for questions. But at any time, feel free to ask your questions in the chat, and we will either respond to them in real time or save them until the end. And these materials will be shared with folks after the webinar. We're going to start with a really high-level overview for those who may be kind of brand new to the Continuum of Care. We'll talk about what is the Continuum of Care. What is this HUD Continuum of Care NOFO, Notice of Funding Opportunity? What do you need to know? Key changes. There's a lot of changes this year from prior years. So if you're familiar with the Continuum of Care program, we're going to highlight some of the key changes you should be aware of. We'll talk about HUD's policy priorities. We'll talk about how the funds work. HUD uses the tiering process, so we'll talk about the funding and tiering. We'll talk about how HUD evaluates COCs, what HUD is looking for, and then we're going to get into details for folks who are interested in applying for new projects or for existing COC grantees who are looking to renew their projects. All right, so a continuum of care, for those who are not familiar, it's a group of folks who are coming together in the community to carry out the responsibilities as identified by HUD. So the continuum of care is really a group of folks who are working together in a specific geography to address homelessness. It's a planning network. So in the case of the Texas Balance of State, it's many communities across the state coming together to work together to address homelessness. Some continuums of care are a single county, some are multiple county, and some, like Texas Balance of State, are very large and cover a majority of a state's geography. And COC also refers to a funding stream and a program operated by HUD called the Continuum of Care program. It's a specific funding stream to fund activities related to addressing homelessness. So we're going to be covering that Continuum of Care program competition during today's webinar. And I'll pass it to Hope to just talk a little bit about THN.
Yeah, just a quick overview of THN's role in the Texas Balance of State CoC. So Texas Homeless Network serves as the collaborative applicant, HMIS lead agency, and the court of entry lead agency for the Texas Balance of State CoC. The Texas Balance of State CoC covers 214 of Texas's 254 counties. So that equates to about 85% of the state's landmass and about 47% of the state's population. And as it relates to this process, because we are the collaborative applicant for the Continuum of Care program for the Balance of State, we also facilitate the application process for CoC program funding on behalf of the 214 counties that we cover, which is what we will be talking about today.
Great. So let's get into some of the terminology and some high-level overview. Some of this may be familiar to folks and some of it may be new. So as we mentioned, the Continuum of Care refers to this Continuum of Care program, which is a funding stream administered by HUD. It also refers to your local Continuum of Care. So in your case, the Texas Balance of State CoC. NOFO, you will hear that term, Notice of Funding Opportunity. It used to be called NOFA, Notice of Funding Availability. So if you hear NOFA, It's the same, we're referring to the same thing, the funding competition. Renewal projects are those of you who operate a current CoC program grant that is looking to be renewed in this competition. New projects are those that are not currently receiving funding and are interested in applying for funding through your local CoC's process. Reallocation is a process where CoCs can choose to move funds from existing projects to create new projects that can be in full or in part. And then annual renewal demand, you'll hear that term. We'll get into that in a bit more detail, but that's the amount of funds that the CoC would need to renew all of its existing projects. So if you're interested in applying for a new project, this is who's eligible to do so. So government entities, including housing authorities, tribal governments, nonprofits, and any faith-based organization is able to apply on the same basis as any other organization if it falls into the eligible entities above. So the CoC program's goals are really to support folks from moving from homelessness to housed and providing folks with the services they need to achieve stable housing. A community-wide commitment to addressing homelessness, improving access to mainstream programs. So folks who are experiencing homelessness may need support from a variety of different community resources and trying to bring all those together, supporting self-sufficiency, and providing funding to quickly rehouse folks and reduce trauma. So the NOFO is HUD's competitive grant program to fund local homeless response system. Up to this point, it's been an annual competition. So every year, the CoCs around the country have to apply to HUD for funding through this NOFO process. The goal is to maintain the existing programs that are doing a great job in the community to address homelessness. And also there are opportunities to bring in new programs, and HUD sometimes has extra funding available through what's called the bonus to apply for new projects. And as Hope mentioned, THN is going to submit this single application to HUD on behalf of the Texas Balance of State CoC. So applying through your local CoC is the way that you can apply for HUD CoC funding. HUD sets it up as each of these local CoCs around the country is deciding what projects are needed in their geography, and then we'll submit them to HUD as a single package. So the local CoCs, again, are applying to HUD through this NOFO, and the program funding is competitive. Each CoC is given a maximum amount of money that they can apply for, but only a portion of these funds is safe, which is where the competitive part comes in. Some of the funds are guaranteed, and some of the funds are safe, and we'll talk about that in a bit. That's HUD's tiering system. So as part of the NOFO, the CoC is going to submit both renewal project applications, so the existing grantees that wish to renew and that the CoC wishes to renew, those will be submitted, and then there'll be an opportunity for new project applications. So HUD is facilitating this national competition where CoCs around the country are all applying. Each CoC is facilitating a local funding competition. So this local competition is where your CoC is evaluating the performance of all the existing CoC grantees, so those renewal projects, to determine which of them will be submitted to HUD and how they will be ranked and prioritized. And we'll talk about the ranking in a bit. And the second part of that is soliciting and selecting new projects. So again, HUD will indicate in the NOFO how much funding CoCs can apply for new projects, and the CoC will facilitate a local competition to solicit new project applicants. So I mentioned this two-tier system. HUD has a two-tier system to facilitate this competition. Tier 1 is considered safe. So those are the funds that the CoC will get through the competition, and the rest of the funds are competitive. And HUD has a formula that they apply to Tier 2, but basically all CoCs nationally, there's over 300 CoCs nationally, are competing for their projects in Tier 2. So once the CoC evaluates and selects all the projects it wants to submit to HUD, both the renewal and new, the CoC is required to rank the projects in priority order. So if your CoC has 50 projects it's submitting to HUD, which may be a mix of renewal and new, the projects must be ranked from 1 to 50. And the ranking is really based on the CoC's priority. So HUD makes clear in the NOFO that the ranking is how the CoC is telling HUD, these are the projects we would like to prioritize for our local community. And then once the CoC completes its ranking, some of the projects will fall into tier 2. So you can apply through your local competition and be selected by THN to be submitted as part of that collaborative application, but it's ultimately up to HUD whether the project will be funded or not. And typically those announcements come out in the springtime. We'll get into that a bit more later. So the CoC is submitting 3 big things to HUD. The first is the CoC level application. THN, as the collaborative applicant, is putting this together. So HUD will pose many questions to the CoC about how they operate, how they set up their community structure for soliciting feedback from the community, how they partner with different organizations in the community, how they're performing data-wise. So there's a lot of different pieces that HUD is evaluating the CoC on. This is scored. The HUD is scoring your CoC's application, and the higher the CoC scores, the more likely it is to get more of those funds in tier 2. Next is the project applications. Every single applicant who wants to renew or come in for new funds applies through your local competition. If you're selected by THN, then you then have to apply to HUD in a system called eSnaps. So your CoC lead will share more information with you about that if you are selected to submit an application to HUD. And then last but not least is the priority listing. This is basically the list that the CoC is submitting to HUD that says, these are all the renewals that we want to submit. These are all the new projects we want to submit. These are any other kind of decisions we've made about reducing grants, things like that. And then the ranking. So the order of priority from top to bottom. The CoC has to rank every project with the exception of the CoC's planning grant. All CoCs are eligible for what HUD calls a planning grant, which is the funds to operate the continuum of care and fulfill all of HUD's requirements. And the planning grant is not ranked. So let's talk about some of the key changes you should have in mind for this year, especially if you are you've been through this before. All of you definitely pay attention to this because there are some major changes in the NOFO process. All CoCs have to apply to HUD by January 14th. That's the CoC's deadline to HUD, but there's a lot of pieces of the puzzle that THN has to put together to apply to HUD. So CoCs have to set local competition deadlines, and HUD has other dates in the NOFO that says by X date you have to rank all your projects. By X date, you have to get all your project applicants in. So your CoC sets that local competition timeline. So your CoC is issuing the RFP on December 1st, today. Then you have a threshold review process and then a full application process. So we'll get into this more at the end, kind of what to know about the new project process and all the pieces of that puzzle, but just want to kind of frame the general timelines we're working with. And then I mentioned HUD usually makes their award announcements in the spring, where HUD put in the NOFO that they're anticipating awards to be made by May 1st, which does mean if you're a renewal project applicant and your start date is before May 1st, you may not actually know if your grant has been funded yet. And if you happen to be in that position, would encourage you to connect with your CoC about kind of some thoughts on that. So there are major changes to tier 1 and tier 2. Again, tier 1 is the safe funds. This is set at 30% of the annual renewal demand. So if the CoC were to renew every existing grant, only 30% of the funds it would take to renew all those grants is safe. This is a major change because in previous years it ranges, you typically between 90 to 94%. Maybe it's gotten as low as 85%, but it's never been in this range where only 30% of the funds are safe, which means that all CoCs around the country are kind of in a position of potentially losing some resources or getting more resources, but it is a very different competition than we've been working with in past years. And then HUD has a formula to determine which projects in tier 2 are going to be selected by HUD. Part of that is how well your CoC scores. Another part is where the project is ranked. So if a project is ranked at the top of tier 2, it's going to score higher than a project at the bottom of tier 2. And then the last is that HUD is prioritizing projects that have a service participation requirement. We'll talk more about that in a bit. Another major change is a permanent housing cap. This is new. This has not been in place for prior NOFOs. So what HUD has said is that no more than 30% of a CoC's annual renewal demand can be used for any type of permanent housing project. So that includes permanent supportive housing, rapid rehousing, and the joint transitional and rapid rehousing projects. That means that I would guess every CoC is having to make some major changes around this because most CoC, the vast majority of their inventory is permanent housing. That has been what HUD is prioritizing over the last decade, prioritizing getting more permanent housing resources. So all CoCs are kind of in a position of having to reevaluate their inventory and make some difficult decisions about this, which we'll talk about in a bit. HUD is allowing and encouraging CoCs to create new transitional housing and supportive service only projects. Those have not been eligible project types in previous NOFOs. HUD has maybe renewed some that were older, but HUD hasn't allowed CoCs to apply for new transitional housing and new supportive service only projects in quite some time. And we'll talk more about these project models in a bit. There's funds through what's called the domestic violence bonus that can be used to create new transitional housing projects. HUD is no longer allowing new transitional housing, rapid rehousing joint component projects. They're allowing them to renew, but they are subject to that 30% permanent housing cap. And then there's significant changes to the project quality threshold criteria for new projects, which means if you're applying for a new project, HUD is going to be looking at a lot of different pieces of your new project to decide whether you meet threshold at all. And then if you meet threshold, then HUD will decide who's funded in tier 2. So we're going to talk more about the threshold criteria. It's definitely something to keep in mind if you're thinking about applying for a new project. And then there's major changes to the majority of the CoC application. So the questions that THN is going to be working on responding to, major changes to what HUD is looking for. There's an emphasis on treatment and recovery, service participation requirements, engagement with law enforcement, participant self-sufficiency, a lot of different types of questions that have not been prioritized by HUD in the past. I want to call out one kind of thing specifically that we'll get into more later because this will be kind of a key tool that CoCs will be using in this year's NOFO process, which is called transition grants. So I mentioned CoCs can choose to reallocate funding from an existing grant, either in full or in part. HUD does allow what's called a transition grant, which means if you're switching from one project type to another, HUD basically allows you a year to make that switch. So for example, if you operate a rapid rehousing project or a permanent supportive housing project, you could transition to a transitional housing project through this transition grant process. It means that you're reallocating your project, coming in for a new project with this transition grant piece. The transition grant is a good resource because it allows time to make a shift between one project model and another. And then for domestic violence bonus projects, which we'll get into more in a bit, if you have a renewal project that was funded under the domestic violence bonus, you cannot use the transition grant process. If you wanted to come in to switch project types, you would have to reallocate your project and come in for new. Just want to share that now because that's kind of an important tool that CoCs have available to them this year. And we'll talk more about that in a bit. And then there's changes to HUD's goals and objectives. And if you're curious, I would definitely encourage folks to read the NOFO and kind of read about what HUD is looking for in terms of how they're prioritizing CoC funding this year. So you could see here the priorities for FY2025, ending the crisis of homelessness on our streets, prioritizing treatment and recovery, advancing public safety, promoting self-sufficiency, improving outcomes, and minimizing trauma. Each year, HUD publishes in the NOFO what their priorities, goals, and objectives are, and you'll kind of see those priorities weaved throughout the application in terms of what HUD is looking for. Again, more detail in the NOFO, and would definitely encourage folks to check that out. Funding and tiering. So we talked a little bit about this, but again, tier 1, 30% of the annual renewal demand. So most of the funds are going to be competitive this year for CoCs. Tier 2 is kind of everything else. It's the rest of the CoC's renewal demand plus DV bonus plus regular bonus. We'll talk a little bit about those in a bit. HUD allows COCs to apply for new projects through what's called the COC bonus. HUD will set the formula each year for kind of how much bonus you can apply for as a COC. Don't really need to worry about the FPRNs and the PPRNs. Those are kind of HUD's terminologies they use to calculate the bonus. In a bit, we'll talk about like what this means for Texas balance of state in terms of numbers. And HUD's also having a pot of money called the domestic violence bonus. They've had this for the last few years, and there's up to $52 million available nationally for bonus projects that serve survivors of domestic violence, dating violence, sexual assault, and stalking. So these funding changes mean hard choices for COCs, and every COC is in the same position. COCs are going to have to make two sort of difficult sets of decisions as part of this NOFO process. The first is determining which current permanent housing projects will be included in that 30% cap and will be submitted as permanent housing. And then the second is determining which projects will be included in Tier 1, thereby prioritizing them for funding. So COCs are kind of looking at the numbers, figuring out what the strategies are and what options are available, trying to preserve as many resources as possible, and using that transition grant process when strategic to try to retain resources. So for your COC can apply for a little over $37 million maximum. That includes the annual renewal demand, the COC bonus, the DV bonus, and the planning grant. Of that $37 million, only a little over $5 million is considered safe in Tier 1. So you can see these terminologies below. PPRN is basically a formula HUD uses based on the geography that's included in your COC, calculating sort of a need, a preliminary pro rata need for your community. Don't really need to worry about that. It's just part of HUD's formula. 17 million is your annual renewal demand. Again, 5 million in Tier 1. Your COC can apply for a little over 13 million in bonus projects. Your COC can apply for 5 million in domestic violence bonus projects, and then your COC can apply for 1.5 million in planning dollars. So your COC currently has a little over $5 million of permanent supportive housing projects, a little over 9 million of rapid rehousing projects, almost 2 million in THRRH, and then overall that brings to a little over 16 million. So 30% of the annual renewal demand is $5,136,017. So what that means is, in order to comply with HUD's limitation, the COC will have to reduce permanent housing by almost $11 million. So your COC will be in communication with renewal projects about kind of what this means and what's next. But this is a major shift, and want to make clear that this is something all COCs nationally are having to kind of figure out how to navigate this major change. So I mentioned HUD is going to score your COC level application. So these are a combination of narratives, attachment, and data points that HUD is going to look at that are going to be compiled by THN. So this chart kind of shows how the scoring has changed year to year, if that interests you. But I just want to focus here on FY25. 9 points is around project ranking, review, and capacity. Your COC has to follow certain guidelines from HUD about the process for selecting new projects, for notifying folks, for kind of publicly posting certain information as well. System performance, that is primarily your COC's data. So what changes has your COC seen over the last year or two in terms of the number of folks experiencing unsheltered homelessness, for example, the number of folks who exit programs with employment income, the number of folks who exit programs to permanent housing. COC coordination and engagement is 81 points. And then overall, it's 130 points. We're not going to spend time today getting into the nitty-gritty of how HUD is evaluating COCs, but it's very different than prior years. And many of the questions are going to be fundamentally challenging for COCs to answer because they're expectations that have not been in place in past years. HUD also has policy preference points for if majority of projects are in an opportunity zone. HUD also has some guidance about expectations around verifying immigration status through their database called SAVE. If you're a renewal grantee, you've probably seen this language in your grant agreements. We haven't gotten a lot of guidance from HUD about what this entails, and a lot of organizations like don't, unless you're a government entity, you would not have access to this SAVE database. So we're hoping that HUD will provide more clarity on this because it's a little opaque now, kind of what the expectations are around SAVE. Let's talk about kind of general project information. There's a lot on the slide, and I apologize. It's there for your reference later, and I will not read it to you. But any applicant that's submitted to HUD, whether you're renewal or new, has to pass a threshold review. Your CoC's role is going to be, let's make sure all the projects we're submitting are going to pass HUD's threshold review. So hopefully if you make it past the local competition, you'll be in good shape on these. But you have to serve eligible participants in the project. You have to be an eligible entity in order to apply. You have to have financial capacity to operate a federal grant. CoC grants are quite involved, have a lot of expectations, especially in terms of like the fiscal management of the grant. So HUD is going to ask all applicants to explain their experience and capacity to manage a federal grant. There's certain certifications you have to submit as part of your application to HUD. You must participate in the HMIS system, which is the Homeless Management Information System. If you are operating a project, you must enter your data in that system. If you're a victim service provider, serving folks experiencing domestic violence, dating violence, sexual assault, or stalking, you can use what HUD calls a comparable database. It has to still meet all the kind of requirements of an HMIS system, but it's kind of a confidential lockdown system to ensure the confidentiality of participants' information. And I just want to highlight these two things at the bottom. They're quite small. These are new certifications that HUD has added into both renewal grant agreements and this NOFO. So these are affirmations that you will have to sign off on if you're applying to funds through the NOFO. The first is the project applicant will not engage in racial preferences or other forms of legal discrimination, and then you will not operate drug injection sites or safe consumption sites. Again, we don't have like a lot of detail about what this means practically, but this is something you will see in the application if you are selected to apply to HUD for funding. Other requirements is that all projects have to go through the CoC's coordinated entry system. So for example, if you're operating a housing project, HUD's expectations is that the referrals for that project are coming through that coordinated access process. The coordinated entry system is designed to facilitate kind of a coordinated, transparent way for folks to access homeless assistance projects, as opposed to sort of a first come, first serve model that may have existed in kind of previous years. So if you are applying for a project, you must agree to participate in the CoC's coordinated entry process, and your CoC will share more information with you about that. And I mentioned again the HMIS participation. So we're going to talk about the new projects and kind of what you need to know if you're thinking of applying for these projects. So each CoC can determine what projects they are going to allow in their local competition. So these are the project types that are allowable through THN, Texas Balance of States local competition. Under the CoC bonus, you can apply for transitional housing, supportive service only standalone, which we're going to talk about what that means, and then supportive service only street outreach. If you're applying specifically to serve survivors of domestic violence, dating violence, sexual assault, or stalking, you can apply for transitional housing. There are allowances again for transition grants, which we mentioned, and all new projects will be reviewed by HUD to make sure they're meeting the project quality thresholds. There's a variety of different budget line items that are eligible in the competition. We won't have time to go through all of these in detail, but I will try to kind of go over them generally so you're familiar. If you're thinking about applying for a new project, you kind of know what things you can apply for. So there's 3 sort of housing costs that are eligible, which I'll talk about in a bit: rental assistance, leasing, or operating. There's a supportive service budget line item. There's an HMIS budget line item, VAWA costs, which is funds related to administering requirements under the Violence Against Women Act, and then rural costs, which only apply to rural communities. I'll talk about those in a bit. And then all CoC grants are eligible to request admin, which is 10%. You can request up to 10% of your grant minus admin for administrative costs. HUD does technically allow acquisition, new construction, and rehabilitation, but they're not renewable costs. So if a COC were to apply for them, it would kind of be a one-time thing. It would not be eligible for renewal. Most COCs do not allow for projects with these costs, given the limited funding available. There are a lot of kind of details to know about the different budget line items, and HUD's guides are actually extremely helpful. So this link here, CoC Binder, I use it all the time. It goes through all the CoC project types. It goes through all the eligible budget line items. So if you're putting together your project or your budget, I would definitely encourage you to check out the CoC virtual binder. Linked above is sort of the HUD CoC interim rule, which kind of codifies the rules around what the CoC program funds can be used for. And then you can also check out your new project RFP that's coming out through the Texas Balance of State. And one important thing to note is that all CoC projects have a 25% match requirement. Match excludes leasing dollars. So if you're applying for a project with leasing, subtract the leasing out of your budget and then multiply that by 25%, and that will show you how much match you need. We'll talk a little bit about match because it can be a bit confusing, but I would definitely encourage folks, again, check out the CoC virtual binder, has a very helpful overview of match. So CoC funding match can be cash or in kind. So if you have grant dollars or kind of other funds available in your organization, you can have a cash match. So if you have a $100,000 grant, 25%, you need a $25,000 match. If you have leasing in your grant, subtract that out and then calculate it. So when you apply to HUD, you have to identify what sources of match you're going to be submitting, whether it's cash or in kind, and the amount. It's best if you can submit a commitment letter with your application. It's not a hard requirement, but if you are selected by HUD, having match documentation will be a requirement before you can enter into a grant agreement, and you'll have to have a formal MOU or MOA for your match. Let me talk about the match just briefly. Cash match is when you're spending funds on eligible CoC program costs, but they're not CoC dollars. So they're other dollars that you have available. So that, again, could be grants from any source. Some sources are statutorily prohibited, but most sources that you might use are eligible. Cash resources that you may have in your organization. And then if you have staff who are working on grant activities but aren't being paid through the CoC program grant, that can also be counted as match. The main thing with match is it has to be an eligible CoC program cost that you're committing as match. So we'll talk about that in a bit. In-kind match. This is the value of property, equipment, goods, or services that are being contributed to your grant that actually are an eligible CoC program activity, but you're not paying for them through CoC dollars. So an example would be many CoC grantees I've worked with use in-kind match because they have a lot of community partners who are providing services to the participants in their program. They're not being funded through the CoC program, but they're providing resources that those folks can access. And if the activity is not an eligible cost of CoC program funds, it's also not eligible for match. So if you're thinking about match, it has to be one of the eligible CoC program costs. In a couple slides, we're going to talk about supportive services. There's a lot of eligible activities under supportive services, and your CoC program grant is not going to pay for all of them. Like, it's not really realistic for the CoC program grant to pay for every type of service that a participant might need. So if you are working with another organization or even inside your own organization, providing services to folks that are eligible CoC activities, but you're not paying for them with CoC dollars, you can use that for match. We'll talk a little bit more about that in a bit. So if you're applying for a new housing project, so if you're applying for transitional housing, there's sort of 3 different ways you can set up your housing budget. Operating dollars, that's if you own or lease a building that you're going to be using for your project. And there's only specific costs that are eligible for operating projects. So you'll want to check out the CoC virtual binder for that. You can do a leasing model. You can lease an entire single site, or you can lease scattered site units. This is when you, as the provider organization, would enter into a lease with a landlord and then sublease to a program participant. You would pay the rent on the unit, and then the participant would contribute some of their income towards the rent. Leasing dollars, again, are excluded from the match requirement. Leasing models can be nice because you can pay for a vacant unit. So if you have a participant move out and it might be vacant for a month before you can move someone else in, you can pay for a vacant unit with a leasing model. And then rental assistance. There's 3 types of rental assistance. The most common type for a CoC program is tenant-based rental assistance. But if you're interested in learning more about sponsor-based or project-based, definitely check out HUD's guides. So in a rental assistance model, under tenant-based rental assistance, which is the most common type, the participant is going to enter into a lease with the landlord, and they're going to pay 30% of their income to the landlord, or whatever kind of amount is specified in your CoC's written standards. And then you as the organization are going to pay the rest of the rent towards the landlord. You can't combine rental assistance and operating dollars. So just a note about that. So how do you know what to request if you're coming in for a housing project? If you're an existing renewal rapid rehousing project, you already know you can only ask for rental assistance. If you own the building that your project will be operated out of, and you're coming in for a transitional housing project, that would typically be operating dollars. If you plan to enter into a lease directly with the landlord and then sublease to participants, that would be a leasing model. And then if you are planning for the participant to enter into a lease directly with the landlord, that would be rental assistance. If you're using a rental assistance model, you have to use HUD's fair market rents for your initial application. If you're going into a leasing model, you can use HUD's fair market rents. Or if you know your rents are going to be less, you can use actual rents. But more information is available through HUD's guides. But typically, you're going to be setting it up. It's like, I have 1 unit in X county. I'm going to multiply that by the fair market rent. I'm going to multiply that by 12 months. And that's kind of what the cost of that unit is for this CoC program. This is a list of the eligible supportive services under the CoC interim rule. Typically, a project would not have all of these. They might have a handful of these depending on what they're doing in their project. So you could see here, assessment of service needs, moving costs, case management, childcare, education, employment, food, housing search, legal services, life skills training, mental health, outpatient, outreach, substance use treatment, transportation, utility deposits, and then I'll come to this cost related to direct provision of services in a minute. Typically, a CoC program project would have a case management line item to pay for the staff time of the folks who are working with the participants in your program, but you may have other services as well. You may need some funds for transportation for your participants. You may have a part-time person who's working on housing search and identifying units in the community, depending on your model. It's really going to depend on your program model, which of these costs you're going to be requesting. The cost related to direct provision of services is if you are operating the project out of like an office space, you can request some of the funds for that kind of like the overhead of the services. You can request that in the budget as well. VAWA costs, this is likely not going to apply to the majority of folks in this webinar, but HUD has a line item specifically to be responsive to the requirements under the Violence Against Women Act. And HUD allows for what's called an emergency transfer. So if someone's experiencing domestic violence, dating violence, sexual assault, or stalking, they need to be relocated. HUD has built in this line item to basically allow for the costs that it would take to transfer someone to a new unit. There's also some funds available for the cost of complying with VAWA requirements. You will see if you are renewing a grant that this is automatically checked. Doesn't mean there's dollars in this, but the reason why is because HUD is basically allowing you to say, I don't know if I'm going to need this budget line item, but maybe I will. Maybe there will be something that comes up and we need to do an emergency transfer. HUD will basically allow you to move money from your grant into that budget line item. So that's kind of nice. It's not something you can always know if you're going to need, but HUD has built it in such a way where if you needed to move funds to that, you could. And then last is the rural budget line item. For applicants who are serving rural geographies, there's some eligible activities that you could build into your grant. Short-term emergency lodging, including motels or shelters directly or through vouchers. Repairs to units in which the people you're serving will be housed. It's not kind of like a general repair budget line item. It's for kind of bringing a unit up to housing quality standards for HUD. You could use funds to do that. And then staff training, professional development, skill development. The idea is kind of to be responsive to some of the unique needs you might see in a rural area. So for example, maybe you're looking to move someone into your housing project and you have no shelter in your community and you really need a resource where someone could stay temporarily. You could kind of build that into your budget. If you don't have a huge housing stock in your community and some of the units are not going to pass HUD's quality requirements, you could use some funds for that. You will want to check out the rural geocodes. That's the list of all the geographies that are eligible for rural. These funds can only be for rural communities. So if you're applying for funds and maybe you're going to serve rural and non-rural communities, the funds can only be used in the rural communities. All right, so that was your quick overview of budget line items for HUD. A lot more to be said, but there's a lot of resources from HUD that are really helpful. So we're going to talk about the new project types that you could apply for through this NOFO. Transitional housing is a housing project with the idea of facilitating the movement of folks to permanent housing within 24 months of entering that transitional housing. You can set up a transitional housing project with leasing dollars, operating dollars, or rental assistance dollars, depending on how you envision your project working. It does not have to be site-based. In some other funding streams in the past, transitional housing was really more intended to be site-based, but it can be site-based, it can be scattered site, and you have to serve folks who are experiencing homelessness, who are literally homeless, fleeing domestic violence, or any other categories of homelessness that your CoC considers eligible. Some CoCs allow folks who are in what HUD calls category 2, which is folks who are at imminent risk of homelessness. Some CoCs allow folks at imminent risk of homelessness to be served in CoC funded housing projects, and some don't. It's really going to depend on what the needs are in the community, because some communities have so many folks who are experiencing literal homelessness that there just aren't enough resources to go around in addition to that. The service participation requirement. So we mentioned HUD is prioritizing projects that implement a service participation requirement. We'll talk a little bit more in a minute on that when we get to the threshold requirements. There are some limitations to that. So HUD has said you can require participants to take place in supportive services that are not disability related as a condition of staying in the project. So what that means is you could say, okay, you're required to meet with your case manager, X times a month or something like that. But you can't say you must participate in mental health services. You must participate in outpatient health. You must take your medication to stay in the program. Those are considered like disability related services. So you cannot mandate those as a condition of being in the project. The exception being if you're proposing a substance use specific project, so like a substance use treatment designed project, you can require participants to take part in those substance use treatment services to be in the program. But that would need to be kind of integral part of your project design. So transitional housing projects can cover housing costs and services for up to 24 months. Participants must have a lease, sublease, or occupancy agreement. The term of that must be at least a month. It must be automatically renewable, except with prior notice, and it's a maximum term of 24 months. HUD does have a caveat that transitional housing participants may remain in the project past 24 months if they have not identified other permanent housing, but HUD will discontinue the funding if more than half of households exceed 24 months. And this will be up to your CoC's written standards. Some CoCs have more established lengths of stay for transitional housing. Again, a lot of text on this slide, but I'm going to talk through it. So HUD has new threshold requirements this year. So if you're submitting a transitional housing project, whether it's a brand new project or if you're doing a transition grant and switching to a transitional housing model, you are going to have to meet these threshold requirements. I want to highlight a few of them. You have to get at least 7 out of 10 points. So you need to, provide the services folks need to maintain housing. You need to have some prior experience supporting folks experiencing homelessness. You have a plan in place to ensure that at least 50% of folks are exiting to permanent housing after 24 months, and at least 50% of folks are exiting with employment income. Your project will be supplemented with resources from other public or private sources. We're not sure what that means yet. HUD hasn't published their detailed guide, so we're not exactly sure what HUD's going to be asking there. I want to highlight these two because these are new. 2 out of the 10 points is that your program will require program participation in supportive services in line with those HUD rules, which I just discussed, and you'll have to attach some sort of supportive service agreement to your application to HUD. And then this one, 2 points is that you have to demonstrate that your project will provide 40 hours per week of customized services for each participant. You can reduce that for folks who are employed. You can reduce that for folks who have a physical or developmental disability. That's new. We don't have a lot of guidance from HUD about that. Like, how do you document that? Or what does the 40 hours need to entail? We think it means that you will be able to offer 40 hours of services to each participant in the project, whether through your organization or through a partner organization. But again, we don't have a lot of detail about that. So in order to pass the threshold, you're going to need to get 7 out of 10 points. So you're going to have to agree to or demonstrate most of these things in order for your project to be funded. So you'll see in the CoC's local competition, a lot of these questions are being asked because these are things HUD will be looking for. So supportive service only standalone, call it standalone because that's what HUD calls it in the new project application, also known as SSO. So it's basically just what it sounds like. It's a project with supportive services only without housing. So it's not no housing in the project, it's just services. So basically it's services for folks who are unsheltered or sheltered, so folks in an emergency shelter, for example, for whom you as the organization are not providing housing assistance. So it can't be like, well, I have a RAPID or a PSH program, I'm going to apply for supportive service only and just provide services to the folks in my project. That's not allowed. You can't really kind of like quote unquote double dip in that way. It has to kind of be a standalone project that's serving folks in the community experiencing homelessness. It's also unclear if you can designate the funds specifically for one emergency shelter. That's a little bit unclear in HUD's guidance as well. The general frame is that you're providing supportive services and anyone in the community who's experiencing unsheltered or sheltered homelessness could access those services. That's really kind of the intent of it. And it can be offered like in the community, it could be offered in a building, it could be offered in a series of buildings. It's kind of depend on what your project is. It again has to serve qualifying folks. So sorry for the HUD jargon, but categories 1, 2, and 4. Category 1 is folks who are literally homeless, folks who are either unsheltered or in emergency shelter. Category 2 are folks who are imminent risk of homelessness within the next 14 days and they have no alternate housing identified. And category 4 is folks fleeing domestic violence, dating violence, sexual assault, and stalking. So you'll need to consult with your CoC's written standards about those eligible categories. So a supportive service only project can be any of these things. And this is like a newer model for most CoCs, so it's not something that a lot of CoCs have in their inventory. But for example, you could have a supportive service project that provides housing search and counseling. So anyone who's experiencing homelessness could get support with like identifying a unit, removing barriers to housing, working on credit, filling out applications, rental support, things like that. You could have a project that is employment support. So employment supports for folks experiencing homelessness in your community, life skills training, any of these kind of things, or a combination of these things. In the past, HUD has really said, if you're proposing a project with like mental health or outpatient or substance use, like, could you leverage those from another community source versus using CoC program funds for that? So it is something to think about. Like, you don't want to recreate a service that already exists in your community, but if there's a service that's lacking in your community, you could think about applying for a supportive service only project to kind of fill those gaps in your community. And then the supportive service only projects have to pass thresholds. These are pretty consistent with thresholds from prior year. The project is necessary to help folks exit homelessness and increase self-sufficiency. So you do have to make a connection in your application, like how is this going to help folks get permanently housed and reach self-sufficiency? It has to be related in some way. You have to have a strategy for serving folks who have a history of unsheltered homelessness and maybe are not traditionally engaged. You have to supplement the project with resources from other sources. Again, we're not really sure what HUD will be looking for. And then the project will be cost effective. And then there's another type of kind of SSO project that's specifically for street outreach. So there's kind of the SSO standalone, and then there's the SSO street outreach. So this is really the purpose of this is to engage folks in immediate support to support their housing needs. So typically serving folks who are unsheltered and trying to support them to navigate to permanent housing. The transportation costs and the resources that the outreach worker needs to serve folks are eligible costs. So this can include a lot of different things. It could include initial assessment, crisis counseling, addressing urgent physical needs, connecting and providing people with information and referrals to homelessness and mainstream programs, and publicizing kind of the services of the CoC. Again, any of those supportive service budget line items that I just showed are eligible under street outreach, but typically your budget would be set up, primarily with outreach services and maybe some of the other costs associated with delivering an outreach project. Again, the threshold quality requirements for supportive service only, similar to SSO standalone, but I'll just call out this one, demonstrate that the applicant has a history of partnering with first responders and law enforcement to engage folks living in places not meant for human habitation, to access shelter, treatment, family reunification, transitional housing, independent living. The applicant must cooperate, assist, and not interfere or impede with law enforcement to enforce local laws such as public camping or public drug use laws. That's a new threshold requirement, so it's just something to have in mind if you're applying for street outreach. So let's talk about transition grants. This applies to CoC existing renewals. You can reallocate from one project type to another. So if that's something you're thinking about doing, or if your CoC ends up asking you to do that based on their permanent housing cap, this is what you would need to know. So you are reallocating your old project and coming in for that new eligible project, and you will have a 1-year period. The new transition grant would start the day your renewal project ends. So if your renewal project ends September 30th, 2026, your new transition grant would start October 1st, 2026, and you would have until September 30th, 2027 to fully switch from one model to another. You have to apply for one of those new eligible components, so you can transition your project to a TH, an SSO, or an SSO for street outreach. Has to be the same recipient. You can't switch kind of organizations at this point. Your total budget amounts must remain the same. So whatever your budget is on your grant inventory worksheet, you can't exceed that. You can't transition and add money to your grant in the same cycle. HUD doesn't allow that. So it's kind of like a one-to-one. I have a $100,000 PSH grant or rapid. I'm going to come in for a $100,000 TH project, and your cap is the same, but you can move money within your budget if you needed to move money between the budget line items. So again, you'll have 1 year to fully transition. The CoC basically has to wholly eliminate the old project and come in for that single new project. And then the transition grant would be eligible for renewal in future years as that new project type. And you have to have the consent of the CoC to do this. So if you're interested in that, your CoC will be in touch with more guidance on that. Domestic violence bonus. Again, there's bonus money available for projects specifically serving survivors of domestic violence, dating violence, sexual assault, or stalking. DV bonus projects will be treated kind of the same as all other projects with that tier 1 and tier 2 process. And then the eligible project type for the DV bonus in the Texas Balance of State is transitional housing projects. So it's kind of a new standalone project. It's coming in as kind of a brand new domestic violence bonus project. You can't combine the funding with other new project funding. That's more for your Texas Balance of State team to worry about, but just something to be aware of. And then if you come in for the domestic violence bonus, you always have to continue serving that target population. Next year, you can't say, well, we want to, expand and serve more folks. HUD kind of tags it as a domestic violence bonus project, and that is what it must remain dedicated to domestic violence survivors. And again, you have to enter data in that HMIS database. All right, so again, we talked about kind of the three pieces of the puzzle, the CoC application, priority listing, and individual projects. And I think I'm going to pass it to Hope to kind of talk about local process.
Yeah, thanks, Jessica. I think we can go ahead and go to the next slide since we already covered this information. So, a brief overview of the timeline for new projects or new applicants under the CoC or DV bonus. As we shared earlier, we released our request for proposals this morning at 9 a.m. We are currently in the middle of our applicant webinar. We're about 1 hour in. And in addition to opening or issuing our request for proposals this morning, we also opened our threshold review and full application stages in SurveyMonkey Apply, which is the grant management software we use in the Texas Balance of State CoC to facilitate our local application process. Since that opened at 9 a.m., folks will have until 8:59 p.m., so right before 9 p.m. on December 3rd to submit their threshold verification. And we'll talk about that a little bit more on the next slide. Before we move on, I just want to note that these are not the only dates that are relevant to new project applicants. We have a much more detailed timeline in our request for proposals, and that's where we provide deadlines for things like scoring, and issuing the priority listing, quality corrections, and quality review. So if you are interested in applying, please ensure that you review the RFP for all of the details. And our full applications will be due in SurveyMonkey Apply on December 10th at 5 p.m. Recognize that it is a very quick turnaround. We have to have a very accelerated timeline this year in order to conform to the conditions of the NOFO. We typically try to give folks at least 2 weeks to submit their materials. And unfortunately, that was not an option this year due to the time constraints and having to meet all the other pieces of the process. But because we have such a short turnaround time this year, we really tried to scale back the volume of our application questions and the information that we're putting out to make it as simple as possible for folks to apply. So if you are a returning applicant, you will see a much shorter application this year than you've seen in years past. We've also done a complete overhaul of our request for proposals, which we're hoping is going to be a positive change for applicants. I think our RFP last year was like 140 pages. This year it's 36. So again, we've really tried to scale back the amount of information that applicants have to work through and the amount of questions that folks will have to respond to in our local application process. And I think the last thing I'll say before moving on is the changes in our local application process. We have tried to bring in some questions from prior years eSNAPS applications. So that way, if folks move on to the full application stage, you will already have a starting point for those eSNAPS narratives so that you're not having to create unique narratives for the CoC and then create unique narratives for HUD as well. So again, recognize this is a very quick turnaround, but we have really tried to minimize the number of things that we are asking applicants to respond to and provide to us in order to be considered for moving forward in the application process. If we can go to the next slide. So a quick overview of what all of that means. So as I said, we have a threshold verification. So last year, this was called our intent to apply. This year, we have rolled our intent to apply right into the threshold verification. So this is the first step that anyone will need to complete in order to be considered to move on to the full application process. Again, the threshold verification is due by 9 p.m. on the 3rd. And so within the threshold verification, which will take place in SurveyMonkey Apply, which is also called Apply, an applicant will respond to some really basic questions about their organization and about their project. And those questions allow us to determine the applicant's initial eligibility and determine whether or not an applicant meets the minimum threshold requirements outlined in our RFP to move forward to the next step of the process. So we've also scaled back the number of things that we're asking in our threshold verification this year. This piece does require a manual review by THN staff in order to determine eligibility. And our goal is to respond to all submissions within 24 hours, whether that means your submission was approved and you'll move forward to the full application, or your threshold verification was denied and you will not be able to move forward to the full application. Another key change this year is that because of the accelerated NOFO timeline and the anticipation of a high volume of applicants, we are only allowing new project applicants to submit one opportunity to meet the threshold verification requirements. That means that if an applicant does not meet the minimum requirements in their initial submission, they will not be able to resubmit their threshold verification or revise their submission. We do have all of our requirements outlined in our request for proposals, so I would ensure that you review that in detail before you begin to ensure that you are not missing a piece of the process and don't get your opportunity to move forward in the full application process this year. So the intent is that as we review threshold responses, if folks are approved, they will move right into the full application stage. You do have until the 3rd to submit your threshold verification. And then from there, THN will review all of the remaining verifications by the 4th, which means if you submit on the 3rd, you may not be able to access the full application until the 4th. Ensure that you read the instructions, but don't wait too long to get submitted because we have built in the threshold piece into the full application timeline. And the full application also occurs in SurveyMonkey Apply. And again, you'll advance to the full application if we're able to determine that you meet the initial eligibility requirement. This piece of the process will require applicants to respond to a series of short and open-ended questions. So we ask things like additional detail about the proposed project, questions that allow us to determine your agency's capacity to operate a continuum of care project, information about what your proposed budget will be, and then applicants will see some component-specific questions depending on which application type they're applying for. So there's different questions in each of our application paths. And then all applicants will respond to some limited information on match and monitoring, and then leverage as well. Again, we've tried to scale back as much as possible of what we're asking for folks. So if you're a returning applicant, you'll no longer have to upload things like your monitoring history, your match documentation, letters of support, information about your systems or your agency's accounting system. We've really tried to reduce to just the minimum number of things we need to determine eligibility and scoring. So those required uploads applicants will be prompted to upload their uploads at the last stage in SurveyMonkey Apply once you get through the local application narrative questions. And those required uploads are the eSNAPS applicant profile and the project application, the HUD Form 2991, which is the certification of consistency with the consolidated plan, a supportive service participation agreement if you are applying for a transitional housing project, and then any documentation of leveraged commitments if you are leveraging healthcare or housing commitments in your proposed application. All of this is outlined in our RFP, and we've also put out a new project application guide that simplifies this process for folks. I think from here we can move on. Okay, so in a typical year, at this point, we encourage folks to refer to the detailed instructions to complete their eSNAPS project application. I haven't checked since the webinar started, but as of the time this webinar started, HUD has not yet released the detailed instructions or navigational guides for the FY2025 eSNAPS program applications. When those are available, they will be posted at that link, and we will send out a listserv information when they do become available. Those instructions are pretty key to the process, as there are additional details in the navigational guides that you won't find in the application. And as a CoC, if we get to the point where HUD has not yet released the eSNAPS applications and the detailed instructions, we will consider what extensions might look like to submitting the eSNAPS application. And when we release those, we will encourage folks to essentially go back and check any work that they've completed so far. And through our quality review of new application materials, we will be checking eSNAPS applications against the instructional guides. So they are a very important piece of the process when they are released.
Great. I'm going to talk a little bit about the healthcare and housing leveraging. This is sort of a unique concept to this HUD Continuum of Care NOFO, and it's an important piece if you're thinking about applying for a new project. This would apply to new transitional housing projects. It would also apply to any grantee who's doing a transition grant to become a new transitional housing project, because you are considered a new project by HUD. If you have leveraging commitments, you can get the CoC can get points for those. So as part of the national competition, HUD scores the CoC, and one of the things HUD scores on is housing and healthcare leveraging. In our experience in prior years, CoCs who can submit new projects with housing and healthcare leveraging are more competitive in the competition and more likely to get more resources. And this will also impact your new project score. If you're applying for a new project, this is one of the things that you'll be evaluated on. You're not required to have housing and healthcare leveraging, but if you can put together a leveraging commitment that meets HUD's requirements, it will make your application more competitive. So we're asking for applicants to think about whether they can bring in housing or healthcare leveraging to your project, and if so, you'll identify that when you respond to the RFP. Let's talk about what this is. This is one of the more complex concepts of HUD, I think, the leveraging. So hopefully we can break it down into more manageable pieces. So let's talk about healthcare first. If you're applying for a new transitional housing project and you bring in leveraging, what that means is you have a written commitment from a healthcare organization for one of these two things, either or. The first is you have a partnership with a substance use treatment or recovery provider who is saying that they will provide access to treatment and recovery services for all participants in your project who qualify. So if you have a partnership with a substance use treatment provider in your community, maybe your organization does substance use treatment and recovery services, and you have a commitment letter that says we are committing for X project of X organization that we will provide these services to any participant who qualifies, that would be something HUD considers healthcare leveraging. The other option is you have a written commitment from a healthcare organization who's providing you healthcare services for the participants in your project that's equivalent to at least 25% of the funding being requested for the entire project. So what this means is it could be a mental health provider, it could be a health provider that's saying that we are providing in-kind health-related services to the participants in your project, and the dollar amount, the value of that commitment is 25% of your total request. So if you're applying to the CoC for a $100,000 grant and you have an in-kind commitment from a healthcare provider or a mental health care provider for $25,000, that would be considered a healthcare leveraging commitment. It does have to be kind of valued at local rates. So whatever your local rate is for healthcare, just make up a number because I have no idea what it would be in your local communities. Let's say it's, $300 an hour and they're providing, X number of hours of services and that totals 25,000, then you would meet that threshold if you were coming in for a $100,000 grant. These types of arrangements can take time to set up, but hopefully many of you already have existing relationships in your communities with substance use treatment providers, health or mental health providers. So you may already have these relationships in place. It can be from different sources. It could be direct contributions from a health insurance provider. It could happen. A health insurance provider says, we want to commit to your project. We want to support your project, and we're going to provide, basically a cash contribution to the project to cover health services. It could be, like I mentioned, the provision of in-kind health services that's sort of tailored to the folks in your project. It could be health, mental health, dental, substance use. It does, at least in the past, the eligibility for the project has had to comply with HUD program and fair housing requirements. So it can't sort of say, well, we'll only serve like this group of folks in your project. Generally, it has to be for anyone in your project who would qualify. And then you generally can't restrict eligibility based on the healthcare service provider's requirements. So it can't be, like I said, it can't be, only folks who meet our requirements, only folks who are, in this zip code, for example, are eligible. It has to be available to any participants in your project. A few things to keep in mind: your CoC will need a formal written commitment. So be prepared for that. It has to include certain things. So you'll, submit something with your RFP app response, but your CoC may need to work with you to say, we also need your letter to say X or Y. We'll know more once HUD publishes their guides. You will need to provide some justification for the leverage amount. So if you're doing that option B, which is the value is 25% of the total project cost, you'll need to kind of quantify how you came to the number that you're coming to. Again, it has to be valued at local rates. You have to provide some specifics of what the services will be. It doesn't have to be extremely detailed, but like if you're providing mental health services, just kind of explaining kind of what the services entail, whether it's outpatient or navigation or whatever the case may be. And then just for your reference, projects that are selected for funding by HUD will likely start in mid to late 2026. So you would need to tell kind of your partner that the leveraged housing resources would need to be available upon the start of the project. So that's healthcare leveraging. That's one part of it. So if you can get healthcare leveraging, fabulous. If you can get healthcare and housing leveraging, even more fabulous. If you can only get one or the other, or if you can't get any, we know it's hard to put these types of relationships in place, especially so quickly. But some of you may already have these relationships established. So the second piece is leveraging housing. So you're demonstrating that you've applied for a new transitional housing projects that's bringing in subsidies or subsidized units that aren't funded through the CoC or ESG program. So if you're applying for a new transitional housing project, this means that you need to if you want to meet the threshold for leveraging housing, you need to bring in leveraged housing resources for at least 25% of the units in your project. So what that means is, let's say you're applying for a 12-unit project, and or you want to have 12 units in your project, and 25% of those needs to come from another source that's a non-CoC source. So I've seen this set up in different ways. The most common way I've seen is through a public housing agency who's saying, we will commit 3, 4, 5, however many vouchers to this project. I've seen that happen. I've also seen it be more from like a local commitment. So I'm trying to think, it was maybe like a local CSBG or something like that, where there was a local funding source and they were committing sort of a dollar amount saying we will cover 4 units at fair market rent for 12 months. So there's different ways that you can set this up. It could be an allocation of units in a low-income housing tax credit building. Again, these things can be hard to set up But if you have something like this already in place, or if you have a strong relationship with maybe one of these partners and could ask if they could commit a certain number of units or vouchers to your project, then that could be really valuable. Again, you'll need a formal written commitment. The start date, again, would be mid to late 2026. And letting your housing partner know that you will need to wait to hear from HUD whether the project was awarded funds. And then you will need to provide some specifics in your letter about what the source is. Is your source housing choice vouchers? Is it low-income housing tax credit? Is it your local housing trust fund? You kind of need to explain what the source is. All right, and I'll pass it back to Hope to talk about renewal project process.
Yeah, thanks, Jessica. So this process will look pretty similar to the new project application process, but a lot more scaled back. So all of the deadlines that I covered earlier are also applicable to renewal projects. So again, we released our RFP this morning at 9, and that is also when our threshold review and full application opened in SurveyMonkey Apply. As of right now, we are anticipating that or requesting that all full applications will be due by 12/10/25 at 4:59 p.m. As I stated earlier, we will consider extensions for the eSNAPS application, depending on when that is released by HUD. If it is not released in time, to give applicants sufficient time to respond to those narratives and submit in our process. If that does occur, we will email everyone that is applicable to, which will be both renewal projects, transitions, and new project applications. I think we can move on to the next slide. So the renewal project process will look pretty similar in years past, with the exception that we have scaled back this process significantly, given the accelerated timeline. We have created a standalone instructional document for our renewal projects, called our renewal project instructions. So renewal projects will not need to sort through a request for proposals to get the information they need. They will instead follow the renewal project instructions that were sent to them. And really, we made that change this year to try to ease the process and create some efficiency in the process for both THN and for applicants. Unfortunately, because of the requirements and limitations in the NOFO this year, not everyone who is a current grantee will be considered a renewal applicant in 2025. So some folks have been asked to, instead of submitting a renewal application, submit a transition application or a DB reallocation instead. Those folks have already received direct communication from THN as of this morning. And that would have come from our TXBOSCOC email. So if you are a currently funded grantee and for some reason did not receive direct communication from us this morning about your application path, please reach out to us so we can make sure you are following the correct process. But aside from the change in the RFP process, renewal applicants will work through the process that they've worked through in years past, which is submitting that threshold verification by 8 or 9 p.m. on December 3rd, which again is very basic questions about your agency and the renewal project that you are requesting to renew. And that requires a manual review by THN staff. And we are going to strive to review all of those within 24 hours of submission. So that's really where we're verifying that you have an active SAM registration, active UEI, and that you are still eligible to do business with the government. And then from there, those renewal applicants will move forward to the full application stage, which we have greatly simplified this year. So there's very few narrative questions that you'll have to respond to. And then outside of that, the final pieces of the process are uploading your completed eSNAPS applicant profile, your project application, and your HUD form 2991, which again is the certification of consistency with the consolidated plan. As I said, for the new project detailed instructions, HUD has also not yet released the relevant instructions for renewal project applications. But we do anticipate that renewals will be able to import their information from the last year's eSNAPS application and then work through any required changes to submit your application this year. And as I stated previously, when HUD does release that information, we will send that out as quickly as we receive it.
Just one note, if you are doing a transition grant application, you won't be able to import last year's information, but you can use last year's renewal application as a point of reference. You should be able to still see that in eSNAPS and use it as a point of reference. For example, your narratives about your financial capacity and things like that. You don't have to do it from scratch. You can refer to your old applications.
Thanks for that, Jessica. And I think that reminds me that if you have applied for our applied in a prior year's competition and have worked through the quality review stage before, we would encourage you to reference your prior eSNAPS applications and try to pull from those basic narrative questions as much as possible, especially if we've already reviewed and vetted them, of course, with any exceptions and changes to program type that you're applying for. So in terms of next steps, I know we've been giving y'all a ton of information, but a couple of key next steps. We are going to continue to release information as quickly as possible. All of that information will come from the txboscoc@thn.org email. If folks could please direct their questions to that email rather than a specific person at THN, that's going to get you the quickest response. If you're not currently receiving our emails, we have linked in the slides where you can sign up to be a part of our listserv. And I'm wondering if someone from THN could maybe drop that link in the chat. As I plugged earlier, we would really encourage you to review the RFP and the NOFO prior to submitting your threshold verification to ensure that you have an understanding of the expectations and to ensure the highest likelihood that your threshold verification is going to be approved. Because as I stated earlier, because of the volume of applicants we are anticipating this year and the timeline, new project applicants will only have one opportunity to demonstrate that they meet the threshold requirements. And they will either move forward if we can demonstrate initial eligibility, or they will not be able to revise or submit a new threshold this year. Additionally, we have put out some supplemental resources this year. So as I said, we have developed a new project application guide, which is really pares down the RFP to kind of the basics of the application process. So we would encourage you to reference those materials as we post them. And after you reviewed all of those materials, we would encourage any interested applicant to work through the threshold verification process in our local application system called SurveyMonkey Apply or Apply. You'll need to, if you haven't used this portal before, you'll need to create an account. If you have used the portal before, you'll need to be able to ensure that you can log in with your credentials. Again, HUD has still not released the eSNAPS project applications, but we encourage folks to go ahead and log into eSNAPS. And one, make sure that you can still log in and that you don't need to reset your password. As a reminder, THN cannot reset your eSNAPS password. That has to go to HUD. There is a specific email address that you can Google. Maybe we can also put it in the chat, Billy, where those password resets need to go. Despite the eSNAPS project application not being available, folks can still ensure that their applicant profile is up to date. And as outlined in our RFP, if you do not already have an organizational code of conduct on file with HUD, you will need to ensure that you have attached a code of conduct to your applicant profile. You can find that in detail in our RFP. There are some very specific requirements that organizational code of conduct has to meet for it to be accepted by HUD. And so a part of our review process is going to be ensuring that your code of conduct meets those requirements. So you don't need to wait for your eSNAPS project application to open before beginning to update your applicant profile. We would encourage you to do that now, so that is ready to go. And then additionally, if you are anticipating submitting a new project application or a renewal or transition application, request your HUD 2991 as soon as possible. Each community has a different process for the way that those forms are approved. In some communities, it's, a pretty quick turnaround time. Other communities, there is a more formal process where you might have to go to city council or county commissioners. If that is the case for your community, I would reach out to your approving official as quickly as possible and let them know that you will be making a request soon with a short turnaround time. Before you send that off for signature, please review the RFP to ensure that you have completed that correctly. We have the correct process outlined in our RFP, and if there are mistakes in the form, you may have to request it. And I think that is it, unless my team has anything else to add as far as next steps. But I think I covered the main pieces. If we can move on to the next slide.
Great. I can kind of talk through some of these general resources. So obviously your CoC will be posting information on their website. HUD has a lot of info on their website, and we anticipate a lot more coming soon. Like Hope mentioned, the renewal detailed instructions and the new detailed instructions will be posted on HUD's website. It's a little bit hidden. They changed the format of the site. So when you go to that site, you will click where it says FY2025 Continuum of Care competition. It looks like a link, but it actually is like a fold open. It'll fold open and show you all the different materials for this competition. So that's where you'll be able to find your renewal and new instructions. The National Alliance to End Homelessness has been putting out a lot of materials about the NOFO already. So if you're interested in learning more about the NOFO, learning more about what's different this year than last year, there are some kind of nice, easy to digest guides from NAEH that you can access at that link. eSNAPs, if you're brand new to eSNAPs, there's tools that HUD has put out, and they are very helpful. So if you're in eSNAPs or trying to get into eSNAPs and you're feeling lost, use the guides. 9 times out of 10, if you walk through the guides step by step, you can resolve the issue. Sometimes there's a missing step that maybe has been overlooked. So definitely use those guides. Same with the detailed instructions and navigational guides. If you walk through them step by step, you can typically get to the screens you need to get to. All applicants must complete the applicant profile. You can't actually apply for funds without one. So if you're trying to set up a new project application and you can't figure out what's going on, make sure your applicant profile is set up. That's kind of step 1 to be able to apply. When you're done with your application in eSNAPs, you will have a submission summary page. If you have any red X's, that means you need to go back and fix something. There's a form that HUD has called the 2880. This form trips people up a lot in my experience. It's not like necessarily the most intuitive way that it's set up in eSNAPs, but there's a link to the guide here. If you're getting stuck on your 2880, use this guide about updating the applicant profile, and it will walk you through it. And again, Hope mentioned the code of conduct, and there's more information there. General eSNAPs tips. If there are multiple parts to one question, make sure you're responding to each part. HUD will look for that. If there's 4 parts and 3 subparts to the question, HUD's going to want an answer to all 4 parts and all 3 subparts. You can number it or kind of label it so that it's easy to read. Make sure you're answering what the question asks for and leave it at that. You don't need to provide necessarily more info than what HUD is asking you for. Especially there's a narrative called your project description, where it's like, basically describe the entire scope of this project and answer A, B, C, D, E, and F. Answer A, B, C, D, E, and F. They don't need G, they don't need H or I, just kind of stick with the question. HUD will have more details in those detailed instructions about exactly what they're looking for. each application section stands alone. So you can't say, C, response to question, 3A. HUD wants to see the answer there. It might be different reviewers reviewing different parts of your application. So you'll want to kind of answer each question accordingly. You can build on something, but each question has to actually answer the question being asked. And if a narrative is asking for actions or strategies, please be specific. It can't really be kind of vague. HUD really wants to see like concrete, clear actions and strategies. And if you don't know what a question means or what HUD's looking for, that's where the detailed instructions come in. All right, and here's who you can contact. And I think we're moving on to the question portion.
Yes, thank you, Hope and Jessica. Take a sip of water because we've got some questions coming your way. Okay, so I'm just going to read the question and then we can kind of ping pong on who wants to be the one to answer. Excuse me. So the first question is, do we use the FMR for 2026 or 2025? Jessica, do you mind taking that one?
That's a great question, and we have a guess, but we don't actually have a definitive answer. If you're a renewal project, the grant inventory worksheet, which your CoC received, is set up with FY2025 FMRs. So we believe in eSNAPs, you will have to set it up with FY2025 FMRs. For new projects, we believe it will be FY2026 FMRs, but we are not sure until HUD actually opens eSNAPs. So we're proceeding with the assumption that it will be FY2026 FMRs, but we are not 100% sure until HUD opens eSNAP. So you all locally will have to set up your project budget in eSNAPs, and it will automatically calculate based on whatever FMRs HUD is using. But without eSNAPs being open or with the guides out, that's our best guess, but we're not 100% sure yet. Sorry for the lack of clarity on that.
Thank you, Jessica. I think any information is good information at this point because I recognize that the folks on this call are probably trying to figure things out just like we are. We're all building a plane in the sky right now, so I think that's helpful. The next question is, for transition programs, do we need to submit a new TH grant or could it be SSO or SO request? Hope, do you want to take that one? Or would you like me to take that?
Yeah, so for we are requesting that folks, if you are transitioning from a current housing program, we are requiring that those folks also transition to another housing program because of the shift in project design that would be required from operating a housing program to a non-housing program. As a CoC, we have determined that any transitions that are required will be to a transitional housing program.
Great, thank you. Okay, moving on. This is for an SSO only project. Is there a hard, fast requirement that beneficiaries have experienced homelessness in the last 6 months, like rapid rehousing? Or can an applicant propose SSO for formerly homeless persons who have moved into an array of permanent housing available in the community, no matter what the funding that supports that housing?
It would have to be serving folks who are currently experiencing homelessness. So HUD says it has to serve categories 1, 2, or 4. Category 1, literally homeless or in shelter. Category 4, fleeing domestic violence. We're a little unsure if category 2 is actually even eligible based on HUD's other laws and rules. We've submitted a question about that, but category 2 is folks who are at imminent risk of homelessness within 14 days, like documented in some form or fashion. So no, it would not be able to serve folks who are formerly homeless.
The next question is, this individual's understanding is that PSH projects cannot be reallocated down to TH projects. But Jessica, do you mind providing clarity on that?
They can, and in many CoCs, they will have to. We work with CoCs where 90% of their inventory is permanent supportive housing, and HUD's only allowing the CoC to submit 30% of their ARD as permanent supportive housing. So there will not be an option. The project must be reallocated and can either come in for something brand new, like as a transition grant applicant, or if they don't want to do the new thing, they are just reallocated altogether. So the PSH to TH transition is a little bit interesting because like those folks were in PSH for a reason, right? They needed long-term supportive housing and subsidies and services to be able to stabilize their housing. So have sought clarity, and many other COCs have sought clarity from HUD whether like the folks in PSH may actually like qualify for the TH when they're done, and we're very unclear on that. What we do know is if you switch from a PSH to a TH, you will have that 1 year transition period to support folks to kind of exiting to another permanent housing resource, knowing that all the permanent housing resources are stretched really thin, right? So it's not it's a very kind of challenging situation that COCs are in, especially those who have a lot of permanent supportive housing inventory.
Okay, let's keep moving. Hope this next one is for you. For the threshold verification, where is the basic questions to review before completing the Survey Monkey template?
Yeah, so it is in the RFP. I don't remember the pages off of the top of my head, but I'm going to find them for you really quick. So if you go to our RFP beginning on page 21, there is a list of threshold requirements. Not all of those are going to be reflected in the threshold verification. Some are going to come into play at the full application stage. But you can review page 25 and 26 of the new project RFP for the full list of threshold criteria.
Great, thank you. Okay, the next question, and I know we got a couple that just came in, so I'm trying to make sure I get everything. Okay. This question is more for CoC merit, so that's the collaborative applicant THN. But this individual was wondering that it says I understand that a max of 13 points are available for the priority of protecting public safety. I'm curious what THN is expecting to report, or are we prepared to not meet all the points, i.e. SORNA? So my answer to that question is, excuse me, we are prepared to report the facts and the information that is available. So we will definitely be looking at all that merit criteria and providing all of the true and available information when we respond to those questions. The next question we have here is, who fills out the HUD 2991 form?
Take this one. So this varies by community. We do have a linked list of consolidated planning jurisdictions linked in our RFP. I'm going to go ahead and put that in the chat here. So this, the list that I just shared in the chat, is a list of all of the consolidated planning jurisdictions in the Texas Balance of State COC. Every community on that list is a city unless it explicitly says a county. And if you are not on that list, then TDHCA will be your consolidated planning jurisdiction. That information is in our RFP if you keyword search for 2191 or certification of consistency with the consolidated plan. The exact person that is responsible for verifying that in your community really varies by community. It's generally someone that is working in your local government, either at the city or the county level. In some communities, it may be someone within your community's community development and planning office. For others, it may be the city manager. And for some, it may be your county commissioners. So I would review this list, and if you need help sorting out who to contact, you can reach out to us at txboscoc@thn.org. We may be able to direct you or at least point you in the right direction of who to get in contact with. But again, if you're not on that list, you'll need to ensure that you reach out to TDHCA, and we have provided that contact information in our RFP.
Great, thank you. And it looks like I did miss one that was sent earlier, so I want to make sure I cover that. The question is, can home rapid rehousing funds be used for match or leveraging? Jessica, do you know about that one?
Yeah. Leveraging, yes. Match, I see Hope nodding. There are some sources that are prohibited, but I don't believe home is prohibited. I can verify that for certain, but I don't believe there's any restrictions on using home as match.
I would also add that the match eligibility always is dependent on what the activity is and if it's eligible under the CoC program.
Okay. Looks like the next question we have, sorry. My document froze on me. Okay. We've been requested to take the transition path. What happens to our current project if we decide not to apply for an FY2025 grant?
If you decide not to do the transition grant path, is that what the question is? I
Yes.
think
Yeah.
your grant would end, your FY24 grant would end whenever it ends. July, August, September, October, November, whenever your FY24 grant ends, and you would close the project. Your CoC could talk more to there's your specific kind of guidance, but in general, the expectation for CoC programs that are closing is you must ensure that all participants are exiting to permanent housing.
And to add to that, if that is the case for any current grantee in the Texas Balance of State, we would work with you to ensure that you are closing out your project and wrapping it up and making sure that there is a path for currently enrolled participants.
Okay, the next question we have is, will we need multiple certifications if our program covers more than one county?
No, so you will only need to request a certification from the primary consolidated planning jurisdiction. So if it falls in multiple, you only need to request one.
Mhm. Belinda's question, and I'm going to read the first one that she put in the chat so that we can have some context. She initially asked for transition projects, so those permanent housing projects that are being asked to transition, can they be street outreach or do they have to be transitional housing? And our response to that is any currently funded permanent housing project, so whether you're PSH, Rapid, or joint TH and Rapid, we are requiring you that you've been notified that we are requiring you to transition to TH, not to another project type. And so then her next question is, so we can apply for SSO or SO. And Hope, would you mind talking a little bit about how they can do that as a new project, but they're currently funded?
Yeah, so again, we are asking that all currently funded projects that have to transition to a transitional housing program so that we can try to preserve as much housing resources in our CoC as possible, recognizing that we are going to have to reduce our permanent housing request by over $10 million this year. But to Kristen's point, any renewal or transition project applicant can also apply for a new project application. And so if your organization is interested in pursuing street outreach or supportive services only funds, you can still apply under the new project application in addition to your transition or renewal project. And you would have to go through the same steps as any new applicant. And so that would be, demonstrating threshold criteria and then working through the full application, responding to those SO or street outreach or supportive services only questions.
Okay. Going back to 2991, we have a question from John Myers that in the past we had, excuse me, in the past we had to provide Abilene and TDHCA 2991 approval. So only one, I'm assuming only one this year instead of the two.
I'm going to double check and make sure this is correct, and we can send out a follow-up email, but I believe it's only one. But when we send out the follow-up materials, we'll make sure that folks get a copy of all of the questions or the follow-up questions that we want to send out. And maybe we can clarify this. I don't know, Billy or Dusty, if you have additional context that I don't have. Or Jessica.
My experience with the 2991 has been HUD wants to see that every project is included at least once.
Mhm.
So what that means in your state could vary, but typically if the project isn't included on anyone's 2991, then that's kind of like a finding. Typically it's a curable deficiency and the CoC can fix it. But yes, typically HUD will want it to be on at least one, but I don't think there's a requirement that it be on more than one if it serves more than one jurisdiction. That's been my experience.
Jessica.
The next question we have is, if you transition a PSH or a rapid project, you will have 1 year to implement the new project, meaning you will exit all those enrolled to PH solutions and have new enrollments be in transitional housing? Or are you saying that those that are currently enrolled will move to TH programming and leasing? It is my understanding that those in PH programs cannot be moved to TH. So I know this is a very complicated thing, y'all. So Jessica, I'd love for you to elaborate that.
I can speak to what we know and also what we don't know. What we know is that if you do a transition grant, you'll have at least your FY2025 grant year to support the current folks you serve in kind of moving on. So using the example I used earlier, if your FY24 grant ends September 30th, 2026, and you're awarded a transition grant and it starts October 1st, 2026, you would have until September 30th, 2027 to kind of support the folks you're currently serving to move on. In a rapid project, that's not too different than what you're already doing, right? It's a time-limited intervention. PSH, a little more complicated in figuring out how to support those folks. We do not believe that folks in PSH or rapid would qualify to like basically move from the PSH or the rapid component to the TH component. We don't believe that's eligible based on what's in the NOFO, but it's also not clear. We've submitted a question to HUD. I know several other communities that have submitted a question to HUD. So hopefully we'll get more guidance. HUD typically will publish an FAQ on their website about the competition. So hopefully they'll do that as well, because I think that is a big question mark, and it's important to know kind of what the options are. But at the minimum, you will have that transition grant year to continue supporting those folks and moving on to the new as folks exit, you could enroll folks under kind of the new component.
Great, thank you. The next question is, what I'm understanding is that the Form 2991 does not need to be completed again if we are submitting a renewal application and already have the Form 2991 on file with the original application. Hope, do you want to elaborate on that one? Or Jessica, either one.
Unfortunately not. You have to do a new one every year. It has to be dated within like the NOFO timeframe. So yeah, unfortunately, everybody's got to do it. Every single grant that's being submitted on the priority list, renewal and new.
This next question, I think, is a piggyback off of Courtney's in regards to, that transition grant. So does the 24-month counter restart if and when the new project starts?
It's an interesting question. I don't think so. I mean, because it's the same participant. But again, we don't really know how HUD would handle like folks going from like a rapid to a TH or a PSH to a TH. Like the 24 months is about the participant's service eligibility. So if I'm understanding the question correctly, I don't think the answer is yes, but it's a little bit gray. I don't know if anyone else wants to add to that, but it's pretty gray right now.
Yeah, I would say that we don't have sufficient information at this point to provide a direct response or a specific response, but we hope that more information is coming or will have come by the time that these projects are getting up and running.
Okay, so I'm going to keep going with this question, the PSH, and then I'll get back to another one. It says, okay, so when you help PSH clients in that transition grant year exit, does that count towards the 50% of those exiting to total independence? It's also a very good question that I don't know if we've got enough information about at this juncture.
The 50% refers to like in your new project application, HUD's going to be asking you like, how are you going to support 50% of folks to exit to permanent housing? How are you going to support employment income? It's kind of your strategy that you're going to be taking. Whether HUD like evaluates you with that specific metric, not at this point. Your CoC evaluates renewal grantees on performance with the metrics that are set locally. So when we're talking about that 50% goal, that's something you will need to articulate in your new project application, or if you're a transition grant, your new project transition application. But it's not a threshold requirement that you've met the 50%. It's that you have a plan for how you're going to support at least 50% of folks exit to permanent housing. And in terms of like PSH clients exiting, generally what HUD is looking for any way of evaluating is like whoever exited during a certain time period, did they exit to a permanent housing destination? And for a TH project, it would be, did folks exit to a permanent housing destination? For PSH, it includes folks who are retained in PSH, but if you switch to a TH, it would really be looking at where did folks go when they were exited from your project?
Okay, we got 10 more minutes, so we'll try to get as many questions in. This person wants to know, when completing the eSNAPS application, do we need to budget for leasing and rent if it's a transitioning grant?
Yes. So if you're doing a transition grant, you'll have the same maximum budget, whatever is on the grant inventory worksheet. THN could provide more specific guidance, but in general, you can move money between line items. You do need to account for the housing. So if you had a rapid rehousing project with 10 units and you're switching to a transitional housing project with 10 units, you got to put the housing in somewhere. It could be a rental assistance model. It could be a leasing model. If you own the building, it could be an operating model. So yes, in your transition grant application, it would be the same max budget you have. You would include the housing, the services, admin, or whatever other line items you would typically request for your project.
Yeah, we do anticipate that transition grants are going to have to make some changes to project design and shift the amounts that are in their budget line items to accommodate their new project design. And we have built some questions into our local application to help kind of prompt what those changes might be, so that when we review your eSNAPS application, we can make sure that those changes are reflected and then determine, what else might need to be moved to get to a viable project design.
Right. Okay, the next question, it appears that this person obtained a new 2991 in August in anticipation of the NOFO. They're wondering, do they need to get another one dated after the NOFO is released?
That'll depend what's in the NOFO. I'll have to look because it will give a date range in the NOFO, but I don't. Let me see if I can look in the NOFO and
Yeah, the
see
day
what
range is November 1st.
Okay,
Off the
thanks,
top of
Bill.
my head, it is in the NOFO, but off the top of my head, it's November 1st, 2025 through January 14th, 2026, which is the national deadline for the application. So yeah, it would have to be
Yes. Oh, actually,
the NOFO says 2024, but that's when we're still wait. No,
it does say,
that's up in the air if there's a HUD typo or not. So
I
it's
think
safer to think November 1st, 2025.
yeah, to be safe, everyone should get a new one because typically it has to be dated during the NOFO competition period.
Yeah, and Cynthia, I see your question there too, and I've been trying to look for the right, because we're trying to just stick factual and find what's written in our RFP and stuff, so we make sure there's so many details. We don't want to share the wrong things if possible. But yes, you are at risk of disqualification if you do not submit that HUD 2991, and that's a HUD guideline and not even CoC. That is a document that is required for your eSNAPS application and to have that in place. for that final submission. So yes, if that's not in place by the deadlines, then HUD could disqualify your application, and the COC may not be able to include that application on the priority listing.
I might need a little bit more detail from you, Gustavo, on your question, but the question is, can the transitional program use property owned by us? So they run a housing authority. And would we be able to use that as leverage? Hope and Jessica, do you feel like you have enough information or would you like more? Okay.
Probably yes. If you're saying we have units that we could commit to this project, like X number of units, probably yes, that could count. I think we'd need a little more information, but just based on face value of what you're saying, most likely yes.
Okay, we got through our list of questions. If we missed your question that you asked earlier, please let us know. It looks like Gustavo said, I'm asking because rapid rehousing didn't allow us to use our own properties.
Right. Yeah, in a TH model, you can use operating, leasing, or rental assistance. So theoretically, yes, you could use it because it is an eligible cost under the CoC program for TH projects.
Thank you. Yeah, so if we accidentally missed your question, please put it in the chat now. We've got 6 minutes left. So this is a time to get any questions answered that you might have. We recognize this is a lot of information and a lot of changes, so please let us know what questions you have. Yes, these slides will be made available as well as the recording of this webinar for folks to refer back to. Okay, well, we can hang out for the next 5 minutes panel, and if folks have questions, we can take them. But if you do not have any further questions, you may get to working on your SurveyMonkey applications, and I'll let Hope
RFP
close it out.
first.
Yeah.
Yeah, before you get to your SurveyMonkey application, make sure that you review the RFP and at least verify that you have an understanding of the threshold verification requirements before you submit those responses. But thanks so much for joining us today. We hope that this was helpful, and we will send out this information as quickly as we can, as well as any other emerging information from this process. And I hope everyone... Oh, go ahead, Billy.
No, I'll chime in too, just in case I didn't read it. If you are a currently funded project, you should have received an email or emails, depending on if you have more than one project, that should be specific to each project type that you have. That would indicate what application path you should take for that project. We understand this is all new application paths. We understand that it's can be very confusing. We definitely tried our best in the time crunch that we had to make the instructions as clear as possible. But if not, if there's any semblance of doubts, please don't hesitate to reach out to txboscoc at HUD. Or not HUD.gov, at thn.org. And we definitely would be more than happy to help ensure any questions that you have of if there's any uncertainty of which application path you should take. But we also put in the chat a link to a list that actually lists all the currently funded projects, and in column A indicates the specific application path that you should take for that project.
Okay.
Thanks for that, Billy, and thanks everyone for joining us.
Yes, thanks everyone.
And yes, Melissa, if you are still here, you can email us. I'll put it in the chat. I think I muted myself.
You did.
All right, we'll stick around to see if we get any more questions.